Hi and welcome back to the channel. Today I'm going to show you 3 amazing tricks to treat the knee. First, I'm going to show you a bloodletting technique that is amazing for knee problems. Then I'm going to show you one Master Tung point that you almost certainly don't know. And then I'm going to show you an extra point from Yamamoto New Scalp Acupuncture. First of all, I want to make sure that everyone understands what's the reasoning behind this video and what I mean by tricks to treat the knee. This is not meant to be a protocol for the knee. This is not meant to be the only points you might need when you're treating knee pain. These are just 3 very powerful tools that you might have to approach knee problems, even complex and serious knee problems that you might want to add to your treatment. It doesn't mean that you're only going to use this, and it doesn't mean that you will use all the 3 tricks in the same patient. I just want you to have these 3 tools and think about them every time you see a patient with knee problems. And what I'm going to show you is going to be applicable to almost any kind of knee pain. So you can think about any of the tools that I'm going to give you, regardless of if it's just a painful knee from an acute injury, if it's osteoarthritis, if it's cartilage degeneration, if it's someone that had a knee replacement. If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses I teach the balanced method to treat pain. This is a technique where you get instant relief in most pain cases. So if you want to learn about it, check them out. So these tools can be helpful in most of these situations. Again, this is not a full treatment. The idea is think about these tools and add them to what you already do. If you already work with the balanced method, well, for sure you get good results because the balanced method is amazing to treat musculoskeletal injuries and problems. So if you diagnose the affected channel and use the balancing channel on the elbow, you're going to get great results. But maybe if you add one of the things that I'm going to show you today, you will improve even more your results. And the 3 approaches that I'm bringing today come from different techniques. First, I'm going to show you a bloodletting technique that is amazing for knee problems. Then I'm going to show you one Master Tung point that you almost certainly don't know. And then I'm going to show you an extra point from Yamamoto New Scalp Acupuncture. So we're going to see bloodletting techniques, we're going to see one Master Tung point and one cranial acupuncture point. So 3 very diverse approaches that you can fit into any kind of treatment that you're going to do. And let's dive in with the first one. The first one is the bleeding area for the knee in the back. These bleeding areas come from Dean Musher's book, Complete Guide to Chinese Medicine Bloodletting. This amazing red book that you can see here. And as I've said in a previous video, this is one of my favorite books in general for clinical practice, but without a doubt, it's my bloodletting Bible. And here, Dean does a very interesting thing, which is he takes the points from the DT area from Master Tung, so points on the back, and he groups them in areas that we can use that are easier to work with than the classical locations of the Master Tung points, and in my opinion are better and give you better results. And so as you can see here, the area for the knee is the size of your scapula, and it is between the scapula and the spine. And what you're going to do is you're going to palpate that area on the side of the affected knee. So if it's the right knee, you're going to palpate on the right side of the patient. And if you find an area with acupoints, so you press and the patient tells you that the area is sensitive, that it hurts, you're going to bleed 2 or 3 points within that area that's more sensitive, and then preferably you're going to add a cup. So you're going to do wet cupping on that area. If you can't do wet cupping, you can just bleed the points and squeeze so a few drops of blood come out, but the results are better if you do it with the cup. This area is very, very effective, but only if you find acupoints. If there's no acupoints, there's no point in bloodletting the area, but if there are acupoints, I guarantee that you will be amazed with the results. This area is used even for patients with degradation of the joint, so maybe they don't have any more cartilage, or they have serious knee injuries, and you see amazing results with it. I've seen patients that are waiting for the knee replacement surgery that every symptom goes away as soon as you do this area. Of course, that if the joint is already in such a bad situation that maybe the patient will still have to do the surgery, but you'll be able to relieve a lot of the symptoms. And this can be done in almost any kind of knee problem. So if you see a patient with knee problems, palpate this area, and if you find acupoints, bleed them, and I guarantee that you will see amazing results. Just as a side note, if you're going to work with bleeding, I advise you to do it in the beginning of the session. So I always start with bleeding and then move on to the needles, because as you know, the bloodletting techniques are going to clear the stagnation, so then acupuncture can do a better job because the stagnation is gone and the Qi can flow freely. Especially if you use distal acupuncture, it's very important to do the bloodletting in the beginning of the treatments. As for the second tool that I'm going to give you, this is a Master Tung point, but this is one of the secret Master Tung points. When I talk about secret points, it's not that the point is hidden somewhere, it's just it's a point that it's not in most of Master Tung's books. So you won't find this point in most of the books that are translated to English. The only book that I know of that mentions this point is Dr. Who's book, which unfortunately is in Chinese. As far as I know, Dr. Who is the only one teaching this point, or of course his students. And the point that I'm talking about is called Xi Ling, which can be translated to knee efficacy. And as you can see here, the point is located in the middle finger on the yang side, so close to the nail, and it's a set of 2 points, 0.2 tsun to the side, to each of the sides of the nail. So you find the corner of the nail and you go 0.2 tsun to one side, you have 1 point, and on the other side you do the same and you have the second point. These points are usually needled at an angle going from the tip of the finger towards the wrist. You're going to do shallow needling, obviously, and this is a fantastic point for any kind of knee problem. This point has the shunjing of the heart, the liver, and the kidney. And its general indications are knee pain, acute knee pain, arthritis of the knee, and heart problems. Just as a side note, within Master Tung's theory, any point that treats the heart will treat the knee. So it's very obvious why the point called knee efficacy has the shunjing of the heart, but you can extrapolate this to any other point and any other approach. So if you're treating the knee, think about points that also treat the heart, and maybe you'll see that you have an improved result there. This point is a little bit painful when you puncture it, but you just have to warn your patient that it's going to be half a second of pain and then everything is going to be comfortable. Of course, it's important for you to have good needling techniques, especially important to use very good quality needles if you want to needle points on the fingers, but it's absolutely okay to do it. And I advise you to try this point because it can bring you amazing results. Usually I will use this point on the opposite side. So if the patient comes with pain on his right knee, I will use his left hand to treat. And to finish the video, I'm going to remind you of an amazing YNSA or Yamamoto New Scalp Acupuncture extra point, which is the extra point for the knee. Where do you locate this point? As you can see here in the image, you will locate it between the B and the C lines, exactly in the middle, over the hairline, you will have the extra knee point. This point is usually painful for the patient if it's active, so what I will do is I will palpate the point over the beginning of the hairline, and if I find it painful, I will needle it. This point is usually used on the same side of the pain. So if it's a right knee pain, I will use it on the right side of the patient's head. And its indication is knee problems, particularly acute knee pain. Try this point, you can add this point, you can combine it. There's no problems in combining Yamamoto scalp acupuncture with Master Tung, with balance methods, so this might be a very useful add-on to one of your treatments that you're already working with. And again, just as a take-home message, this is not a full knee treatment. These are 3 very good tools that might help you improve your results when treating the knee. If you're using the balance method, keep using it. If you're using Master Tung's approach, keep using it. If you're using classical TCM, if you're using Japanese acupuncture, you can always add the tools that I gave you and keep doing what you're already doing. But I really advise you, if you have a patient with knee problems, try these approaches because they really give you good results. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel and share this video with anyone that might benefit from it, and I'll see you in the next one.